Hope is the thing with feathers that perches in the soul and sings the tunes without the words and never stops at all. Hope is the state which promotes the desire of positive outcomes related to events and circumstances in one's life or in the world at large. It is the feeling that what is wanted can be had, or that events will turn out for the best. It shows the path to the distracted and the disheartened. Hope is a part of our immortality. We hope on, we hope ever. We live to make this hope come true. We aspire for a better and affordable dialysis for millions of patients worldwide. We passionately dedicate ourselves for this hope that people have a better life, a better world. Nipro India Corporation, your partner in healthcare. Nipro strives for keeping hope alive in mankind by providing unparalleled quality standards for healthcare, by providing affordable and efficient medical devices, by assisting healthcare providers with new and advanced technologies or devices, by building precision in business processes and state-of-the-art machinery or technology. Established in the year 1954 in Japan, we have focused on developing our business based on our technological prowess. The corporate philosophy of Nipro Group is conducting business from various aspects, contributing to society, and promoting self-realization with creativity and innovation for the future. Today, Nipro is a renowned multinational company with its foothold from Japan extending to Europe, Asia, United States, North and South America, and is truly touching lives across the globe. Nipro's grand vision of artificial kidney or dialyzer manufacturing, first time outside Japan and first time in India by any company, has become a reality with its grandeur manufacturing facility, Nipro India Corporation Private Limited, located at Shirwal near Pune. Nipro has a wide presence in India. There are manufacturing plants in Meerut, Badlapur, Chiplun and Tarapur to manufacture pharma-glass tubings. Nipro also has a production facility in Tripura to produce glass vials and ampules. Nipro India Corporation's sales offices are located in Mumbai, Kolkata, Chennai and Gurgaon. Nipro's dream factory, Nipro India Corporation, Pune, is spread across 50 acres of land with an investment of above 700 crore rupees. This facility has created a benchmark among all Indian medical device manufacturers. Nipro maintains the highest possible quality standards when it comes to minimizing the contamination of the products manufactured in its factory. Every employee at Nipro follows the Clean Room Guidelines, which include clean in-house uniforms, shoes and gloves. Passing through an air shower is compulsory for everyone and everything that enters the production areas. The facility has already established its quality systems as per ISO 13485, ISO 11137, ISO 9001, 2008, CE certificates.
Indian medical device scenario is changing at a very fast pace. It is very essential to maintain high quality standards of the locally produced medical devices. At Nipro India Corporation, we are producing medical devices which are matching to any international quality standard as specified by our principals, Nipro Corporation, Japan. Our vision is to improve medical dialysis treatment within India. We are producing medical devices for dialysis treatment which are of very high quality standard, and we will make these products available to Indian market at a very affordable price. This way we wish to serve Indian society as a whole.
Nipro India's manufactured product portfolio includes dialyzers, also known as artificial kidneys, disposable syringes and needles, SS cannulas, intravenous catheters, arteriovenous fistula needles, blood tubing sets, dialysate solutions. In chronic renal failure patients, the metabolic waste products have to be removed through a routine blood filtering process called as hemodialysis. Hemodialysis is facilitated by a device known as a dialyzer, which functions as an artificial kidney. Our Eliseo range of dialyzers offer optimum hemodialysis. The Eliseo series of dialyzers using polynephron membrane, Nipro-formulated polyether sulfone, are a highly improved range of dialyzers ready for the current dialysis demands. The Eliseo range of dialyzers are manufactured in our factory using the best processes. When a solution of inner liquid is mixed with a spinning solution, the fiber gets formed. This process takes place inside the machines and the fibers are extruded. Nipro's unique polynephron membrane has an optimized asymmetric structure and wall thickness, which improves the mechanical strength of the fibers, reducing the risk of fiber leakage and providing better contact between the diacylate and blood components. The new rippled structure of the membrane fibers makes spacer yarns unnecessary, resulting in a more homogeneous diacylate flow and a smaller dialyzer design. The fibers then pass through horizontal and vertical bars, forming a lattice to form bundles. Bundles are then cut at regular intervals according to the required size. The dialyzer casings are manufactured at Nipro's very own in-house molding machines in a clean room environment. The fibers are inserted into the casing, potted with polyurethane, and the ends are cut, giving a mirror-like finish. The caps of the dialyzer are sealed with an ultrasonic cap welding process, making the caps unremovable. Every dialyzer is checked for leakage using ultra-filtered water. The dialyzer is labeled in a labeling machine, then vacuum sealed, boxed, and sent for sterilization. Eliseo offers unique advantages to the users. Better solute clearance effect for the daily hemodialysis, better tolerance and fewer complications with frequent dialysis, low mortality rate, better control of blood pressure and abdominal cramps, less diet restriction. The redesigned housing and the inside structure of the Eliseo dialyzer improves the removal of small molecules as well as low molecular weight proteins, while retaining such essential proteins like albumin. The optimized asymmetric structure and wall thickness provides improved mechanical strength of the fibers, reducing risk of fiber leakage, better contact between dialysate and blood compartment, higher package density resulting in higher performance, uniform distribution of pore sizes. The polynephron fibers in Eliseo are free from bisphenol A. Bisphenol A is a commonly used component for making plastic bottles and sometimes in dialyzers also. It is considered an endocrine disruptor because it mimics estrogen, a natural hormone, and may fool the body by simulating reactions that are unnecessary and potentially harmful. Scientists have linked bisphenol A, BPA, to a higher incidence of heart disease, diabetes, and liver abnormalities in adults, as well as brain and hormone development problems in fetuses and young children. Other tests have shown that bisphenol A can promote human breast cancer cell growth, decrease sperm counts in rats, and cause erectile dysfunction and other sexual problems in men. The term flux refers to the permeability of the membrane in the dialyzer, across which accumulated toxins and excess fluid pass during hemodialysis. The low-flux cellulosic dialyzers could easily remove the smaller toxins, such as urea and creatinine, but larger molecules that are normally removed by normal kidneys were unable to fit through the pores. A middle flux dialyzer has a membrane that allows middle-sized molecules to pass through, but prevents the accidental removal of protein from the blood. One example of a middle molecule is beta-2 microglobulin, B2M, which can cause amyloidosis, a group of diseases in which a protein called amyloid builds up in the organs and tissues. Nipro's commitment to patient safety can be seen by the non-openable headers of Eliseo. Opening the caps during reuse leads to a range of complications for the patient. AV fistula needles. Nipro's AV fistula needles are manufactured at Nipro's clean room production facilities. The AV fistula needle's ultra-thin walls allow for painless insertion and superior blood flow. Its textured wings provide a secure grip during needle manipulation. The soft, flexible tubing absorbs shock and reduces needle movement in patient. Blood tubing set. Nipro's blood tubing sets are made from a very high-grade PVC. The tubes are extruded and cut in an automatic extrusion machine. They are then assembled, packed in Nipro's clean rooms, and dispatched for sterilization.
Nipro strives towards excellence in manufacturing high-quality needles and disposable syringes. We at Nipro India Corporation have worked through a technology transfer from our principals, Nipro Corporation Japan and Nipro Corporation Thailand. Highly experienced team with international training exposure and armed with imported state-of-the-art tools and machinery. We consistently deliver highest quality product for our patients.
Nipro's ultra-sharp needles, by virtue of a state-of-the-art Japanese technology, ease the insertion and reduce pain and trauma to the tissues in the patient. The crystal clear barrel, made of polypropylene, makes the calibration on the syringe easier to identify, ensuring accurate medicine delivery. The gasket is a thermoplastic elastomer, which is latex-free, causing no untoward allergic reactions, and also provides a smooth, effortless plunger movement. An unique siliconized coating along the needle surface and within the barrel ensures a smooth gliding effect over the skin and a consistently smooth plunger action along the entire length of the barrel, reducing friction and minimizing pain to the patient receiving treatment. The The plastic lamination of the film-to-film blister packaging has higher puncture and tear resistance than the paper lidding of a blister pack. The sterility assurance factor is therefore relatively superior. The package does not get dusty, dirty or wet, even with poor handling and transportation. Syringe production. Nipro's syringes are manufactured at Nipro's very own clean room manufacturing facility. The syringe body is molded in the automatic molding machines. The barrel, the plunger, the gasket and the needle cap are assembled in the automatic syringe assembling machines. The syringes are automatically packed and sterilized by gamma radiation. Nipro syringes are available in the following volumes with Luer lock and Luer slip varieties of 1 ml, 2.5 ml, 5 ml, 10 ml, 20 ml and 50 ml. An intravenous catheter is a catheter placed into a peripheral vein in order to administer medication or fluids. Nipro WingCath is thin-walled, flexible and made from ETFE, ethylene tetrafluoroethylene, which is highly biocompatible, has less penetration resistance and accurate flow rate. The injection port allows for continuous mixing of solutions and has a non-return valve, making the seal more reliable. A sharp Nipro lancet point needle gives smooth insertion without trauma. The distance between the needle heel and the catheter tip is minimal, which minimizes patient discomfort. Place a venous tourniquet over the patient's non-dominant arm and select a site for intravenous catheter insertion. Apply a disinfectant and let it dry. Hold the WingCath in your dominant hand, bevel up to ensure smoother catheterization because the sharpest part of the needle will penetrate the skin first. Small superficial veins are best accessed using a small catheter, 22 to 24 gauge, placed at a 10 to 25 degree angle. Deeper veins should be accessed with a larger catheter at a 30 to 45 degree angle. Upon entry into the vein, the practitioner might feel a giving way sensation. Blood should appear in the flashback chamber of the WingCath. The angle of the WingCath should be reduced to prevent puncturing the posterior wall of the vein. It should be advanced gently and smoothly an additional 2 to 3 millimeters into the vein. With the WingCath safely secured in the vein, hold the cath with the non-dominant hand and withdraw the needle. Close the WingCath opening with the closing cap. The injection port can now be used to insert medications without any more needle piercings. Nipro WingCath is sterilized using Nipro's in-house gamma sterilization technology. Sterilization is critical to every medical device. It is a process that effectively eliminates almost all microorganisms like bacteria, viruses and fungi from the medical device and makes it safe for the patients. We at Nipro have adopted the Gen Next sterilization for our medical devices. Gamma radiation, which is fast becoming the most popular new technology across the globe to improve the shortcomings of various other methods of sterilization. Nipro has been accorded approval from the Atomic Energy Regulatory Board of India to introduce in India in-house gamma technology for sterilizing devices.
Nipro India has started a state-of-its-kind gamma radiation facility, which is unique for the medical device industry. And this is the highest capacity of plant in India, with a capacity of 5 million curie, and it has a total strength of 1.5 million curie today.
Gamma sterilization process. The products awaiting sterilization are stored in Nipro's huge godown. A dosimeter and a yellow sticker are attached to the cartons, which are then arranged in a tote box. These tote boxes are moved into the gamma sterilization plant, where the products are sterilized using gamma rays. The dosimeter and the yellow sticker change color after the process, indicating complete sterilization of the products within the box. In-house process of fiber spinning up to assembled dialyzers. In-house manufacturing of SS cannula from SS sheet. The first private entity in India to use in-house gamma sterilization technology for medical devices. Clean rooms class 10,000 to 1 lakh. Everyone needs someone they can depend upon. Be their faithful friends. When the world fills with darkness, we all need some kind of a light. We at Nipro believe in becoming a beacon shining so bright that it would serve as a light for their entire life. Nipro, your partner in healthcare.